Greetings and welcome to In-Depth. I'm Dike Rostant. We are currently at the San Fernando Teaching Hospital, ready to speak with CEO Dr. Brian Amour about a great deal of works taking place, one of them being the restoration projects at the San Fernando General Hospital. Thank you for making the time, Dr. Amour. I want us to start off by getting a bit of context, please, in terms of the importance or significance of San Fernando General Hospital to this part of the country.
Okay, well, good morning again, and thank you very much for having me. San Fernando General Hospital is part of the Southwest Regional Health Authority, and that serves the southwestern region of Trinidad and Tobago, and that houses a population in terms of residences, works, communities, about 600,000 persons. So that's the significance of where we fit into the healthcare system. And of our 40-plus facilities, the San Fernando General and Teaching Hospital campus is our main flagship area of care as one of our two major hospitals, the other being Point Fortin Hospital. So we offer healthcare services between the hospital, district health facilities, and health centers.
Now, looking at 600,000 persons actually benefiting from this institution, from this building, from the services provided here, sometimes it can be a bit of a daunting challenge to say, okay, well, while we are providing service, we're still trying to upgrade to make things better. What are some of the things that would have been at the forefront, saying, okay, well, this is something that we want to do it now, and we want to do it in a manner that allows us to still serve while we're making those renovations?
Yes, it is a complex undertaking, but we operate as one team here at the Southwest Regional Health Authority. We are led by a board of directors. We have a senior executive team, management team, and we have our 5,000 plus staff across all our facilities. So it is a teamwork, and we all live and work here as well. So we are part of the same community that we serve. So that drives us. From an organizational perspective, we are also guided by a strategic plan that indicates from the board of directors and Ministry of Health and other stakeholders what our priorities are. So we do have to work in two modes, so to speak. We have to take care of persons at the present. We have to take care of our own staff as well. But at the same time, we also have to grow the organization and ensure that we continue to meet international best practice standards and have an environment of care that also meets the expectations of the population.
What are some of the itemized works that have been taking place?
Well, right now, we are undergoing a major restoration project of the San Fernando General Hospital. We have the General Hospital, which is known as the Colonial Hospital. A lot of us were probably born there who live in South or have generations of persons who work in San Fernando, and many persons would know that it was more than a hospital to them. So we are trying to bring back to the community and to encourage our staff that this is something that we own. So San Fernando General Hospital is the area that we have decided upon and for which the government has supported. And we want to acknowledge that we have already gotten a lot of support from the Ministry of Health, Ministry of Local Government, as well even recently the Ministry of Planning to help us form part of this ecosystem with the community so that we could restore the hospital to an environment of care that pleases everyone.
Are there things that have had to be downgraded, shifted? What are some of those challenges that you get while trying to move forward strategically but still serve the existing need?
Well, from my perspective, we all are human beings. Change comes with some risk, some discomfort. So from where we sit, we try to communicate and listen. So we both share what we want to do and we listen for feedback. So in terms of the challenges, it involves planning. There are challenges sometimes in planning. So this has been going on now for probably the last 18 months where we have done a lot of background processes to plan to get to this point where we actually execute works. We also have had to engage our staff. We also have had to gauge the community and ask for their patience and forbearance, which we have been getting. So we would have some disruptions in parking, disruptions in flow.
And it's interesting because I would have been a patient at San Fernando General many moons ago. I know some people talk about the food at Sangre Grande is top notch. I don't know. I've never been, so I can't make that comparison. But just that level of care is something that is unmatched to my experience. You spoke a little earlier of the team members. What has it been like saying, okay, well, it's 18 months thus far, asking for patience and forbearance from people in the environs, but just taking care of staff and making sure that they feel as though they are seen and they're validated while all of this is happening. I know some people like to talk about building the plane while you're flying it, but how has it been caring for team members?
It's a very good question. We do the best that we can, and as I said, it's one team. It's a large team. As I said before, 5,000 plus. 80% of our entire staff actually work and reside in the hospital, in the main. So we engage through several modalities. There's a human resource component to it. There's a quality component to it. So therefore, our quality departments always encourage feedback from our internal customers. We have a corporate communication side of things, and we have what we always like to a one-on-one. We tend to walk, meet and greet as well as best as we can. So all in all, in terms of with the staff, we intend to share the plans of the specifics as to what we're doing. We have heard feedback that they would like to get more internal formal newsletters periodically, what we're doing. So at each stage, even what we are doing today is for everyone to note that we really want to succeed at this. We think it is for the benefit of the country, for which we are doing our part. And it is something that will really, with this quality of work that we do, would carry us, I would say, at least another 10 years.
Okay. And wondering what are some of the things that are happening, and we have about 2 minutes before we take the break, but I know I believe the old hostels are no more. What are some of those other incremental points that you say, okay, well, these are things on the checklist that we're working towards in terms of the restoration?
Good. Well, our restoration, we hope to complete by February 2025. The specific things that we are doing, if we start with the Colonial Hospital, we are basically replacing the roof. We are painting over the entire facility. So from the roof, walls of all the buildings, not only Colonial Hospital, but our new wing and BMQ building, as we call it, where we house the lab. We're also doing beautification, landscaping. We have 6 areas in the hospital. We want to increase the ambience, and we also are halfway through with respect working with local government with rehabilitating the roads and the drains. We also have what we call the bridge link that bridges the teaching and general hospital. We also plan to refurbish those as well. And those are some of the main things that we're doing. The final 2 things are the nurses' hostel, the Colonial Hostel. We are taking down most of those structures, and we're actually demolishing all old structures that are not in use. And with the waterfront new park, it has converted the back of our hospital to the second front of the hospital, so to speak. So all in all, by February, you're seeing a brand new roof, painted building, nice landscape, drive anywhere, and it's only newness. What I tell the team, what we'd like to envision finally is if you put an aerial drone on this hospital compared to San Fernando, it ought to stand out from looking above. So everything will look pristine, new at the roof, orderly in terms of thoroughfare, and basically, quite frankly, beautiful. So that's our vision, and we hope to achieve that by February next year.
And on that idea of a timeline, we take a short break. We're speaking with CEO Dr. Brian Amour. Stay with us. We return after this. Welcome back. We are speaking with CEO of the SWRHA, Dr. Brian Amour, looking at some of the work that is taking place in the Southland as it pertains to healthcare. And Dr. Amour, it seems as though there is a focus on more than just the physical, because sometimes people will be able to afford someone a service and they do it efficiently, but they don't necessarily care about feelings. Where it seems as though you are looking at things from a slightly different perspective. Why is it important to have something like the ambience, the way that you feel when you're going through or coming through this space, really help to leave someone in a positive mood?
Well, two things. At an organizational level, we have watchwords: care, compassion, and competence. The compassion part is important to us, apart from being merely competent, and also to the care that we deliver. And actually, at an individual level, and many of us have experienced it, people always tend to say, paraphrase, and I'm not too sure if it's, I can't remember who said it, I think it's Mary Angelou or someone, that, you could do something for persons, you could do a lot of things, but what people will remember most is how it made you feel. And no matter what we do in the sake of healthcare, persons must feel that they got the best quality healthcare that they deserve, and that their concerns matter. Because despite all the ambience and everything, even when each one of us comes into the hospital, we want to know that somebody is being able to take care of us. And that is what we try to achieve at each and every customer care experience.
And speaking of that quality of care, that quality of service, it seems as though there are things to be proud of with regard to accident and emergency. We're hearing some improvements in terms of timelines. Take me through that, thanks.
That is correct. One important thing with the emergency departments working with the team is that we now are what we say we have gone paperless. It means to say that from the time you enter the door in casualty, as people know it as well, to the time you exit, all levels of staff, whether it be the nurse or the doctor or the patient attendant, we all operate in a digital mode in terms of we operate basically from tablets. Stuff is entered electronically, and it is envisioned that that is supposed to increase the efficiency by which you move through. And we have seen that. We have seen basically between coming to casualty, if your triage immediately in terms of to quickly assess what's wrong with you. That hasn't changed whether it's paper or digital. But because of the streamlining of no paper, we have cut down by about an hour the length of time it will take for you to see a doctor, where it used to be average about 4. It'll take about 3 hours, and then all the investigations that needs to be done, all of that is fed into the system. So that's where we are. We have 5 emergency departments, not only at San Fernando. We have at San Fernando, at our 3 district health facilities, that will be at Couva, Princeton, and Separia, and our second flagship hospital at Point Fortin Hospital. All 5 EDs now are paperless.
Now, it's one thing to say, okay, well, when someone comes in, triage and getting to see the doctor, what does that mean for things that are on paper in terms of putting them into that space so that people can pull information that is up already?
Right. Well, in terms of the paperless system, everything in that encounter is digitized. So therefore, all your medical information, all the investigations and reports, whether they be x-rays or blood tests, it's all there. There is, of course, the ability at the request, as per legal and patient right requirements, if they need a medical report or if they need a copy of the record, the system allows for that, what we call a residual print of that record if required. So that is where we are with respect to the emergency departments. But the customer care experience we want is that everything is real time as it can be. You don't have to wait for a paper to come from the lab to your patient record. It's done instantly. So that is where we are, and we have seen the improvements. And more importantly, we are all able to monitor the efficiency because everything is captured. Nothing is put on the back burner in a paper-based file. Everything is on the front burner, so we can analyze the entire performance of the ED.
Okay, because, and this is not specific to SWRHA, but we still receive calls from time to time of someone saying that they've gone to a different clinic and the person said they don't have their file, so there's a lot of filing that needs to take place again if they're not getting the file itself. So I can see where just having that paperless system allows for a much smoother process and ease of care. So people felt, like I said, felt seen and feel as though they're being taken care of in much more way than one. But you spoke a little earlier in the first half of the conversation. You spoke to partnerships, and I want you to get to that again, please, because sometimes it feels as though you can have individuals or bodies trying to do one thing by themselves, as opposed to who's going to be taking care of the roads, who's going to be taking care of certain other things. So how do partners come together for the work that you're trying to do in offering the care to individuals?
In terms of partners, we would partner with everyone who is for healthcare. So in terms of partnerships, well, first of all, we operate with the relevant ministry, starting with the Ministry of Health. So what you spoke about, for example, in the outpatient clinic setting, that is still a work in progress for us. And with the Ministry of Health is taking the lead with all RHAs with respect to digitizing medical records. So therefore, beyond the emergency departments, we do have other initiatives where we go in to transfer that experience into the wards as well as to the outpatient clinics. We partner with a lot of groups in communities, whether they be business, whether they be non-governmental organizations. We partner with other local community groups. And in addition to doing work inside the building, we also do work outside in the community. And we have one arm, for example, like the Health Promotion Unit, which is our face then to community groups, to NGOs, to really tell people this is what taking care of yourself feels like, and also to sometimes for persons who might find it difficult to come in our building, this is what we also do in terms of strategic partnerships, but mainly with government, non-governmental organizations, community groups, and anyone who is interested. We do have room for persons to give us comments and feedback and to engage us.
I don't want you to talk about community outreach too much because we're going to save that for a whole other conversation. But and I want you to toot your horn a little bit more about the hospital in Point Fortin. Thank you. What are some of the things? What difference does that make, it being there and, like you said, state of the art and cutting edge and doing the work that it needs to there?
Point Fortin Hospital in the view of SWRHA is doing very well, just as well as the legacy San Fernando Hospital. I think the critical success factor there is the team, the leadership team, the staff that work, and the acceptance of the community that we are trying our best to serve. I think that dynamic is very well done at Point Fortin Hospital. There are a lot of strides in Point Fortin Hospital. Our average estimates, because we apply some science, about 13% of the resources of the SWRHA are applied appropriately to Point Fortin Hospital. They have done a lot. They have seen a rise from when post-COVID 2022 till now with the emergency department. If I remember the figures correctly, it's about 9,000 encounters, which is up from the year before. Also too with the outpatient clinics, they have gone up to like about 5,300 visits, up from 4,300 a year prior. So therefore they are making a lot of strides. They have a very vibrant cervical cancer screening program. They have launched same-day surgery within very recent vintage. And similarly, you mentioned Sangre Grande earlier. What we are finding is that some persons are saying, hey, why go San Fernando when we have all of that in Point Fortin? So we are seeing a redirect of preference of the communities to go Point Fortin. We have a lot of commendations. We basically have continual growth at Point Fortin Hospital. We are matching the needs and expectations of the community. And that we have, if you want to get a CT scan done, you could get your report within a couple of weeks. Certain things like ultrasounds, you could get it same day, the report. As I said, we have same-day surgery. Same-day surgery is just that. You go in the morning, you get your surgical procedure done, you're discharged, in the afternoon you could go back home, depending on the procedure. That is happening. We have cutting-edge technology surgeries that are going on there in terms of we have started to do orthopedic surgeries, minor ones as well as some joint replacement surgeries. So we are continually improving in the Point Fortin Hospital. And in fact, sometimes as senior managers, we have to say, well, you could be the victim of your own success. We have to keep up with the demands of the population now that they know that Point Fortin Hospital is not like how it was before. It is a full-fledged hospital in its own right, and it's making a lot of strides. We are very proud.
I'm very glad to hear about that. Is there anything that you wanted to put in terms of set context in 30 seconds while we wrap up this conversation?
Sure. Even though we've spoken a lot about the two hospitals, health-seeking behavior begins in the community, and don't want to get it lost that we have 34 primary care centers, what we call health centers. And therefore, we also have what we call district health facilities that have the emergency department. So health-seeking behavior, while persons may want to come to the hospital and hearing about the emergency departments, it still starts at primary care, and we are also paying attention to the primary care network. So it's a full ecosystem for healthcare, and this is where we are, the SWRHA at present.
And there are many things to be happy about, many things while we work towards still being the best that we can be. looking at that timeline in terms of February 2025, but we want to thank you for the time that you've spent with us, CEO Dr. Brian Amour, looking at some of the work, some of the things that you can see in the SWRHA. This has been In Depth with me, Dike Rostant. On behalf of all of us, thank you so much for joining.